Hi everyone. In this video, we'll be talking about the bacteria that causes the foodborne illness, botulism. And botulism is commonly associated with foods that have been improperly prepared. When people can their own food at home and they don't do the process correctly, there is a risk of this disease. And so let's learn more about botulism. We will be starting with the etiology, which is the cause of the disease. The bacteria that causes botulism is Clostridium botulinum. This bacteria releases a neurotoxin, which is the reason that this disease causes paralysis. The toxin does this by blocking acetylcholine. If you aren't familiar with acetylcholine, or if you haven't taken anatomy and physiology yet, acetylcholine is a chemical released in the nervous system that signals muscle contraction. Clostridium botulinum has a positive Gram stain, so it would show up as purple because of its thick cell wall. This bacteria's shape is bacillus. It also is a motile bacteria and endospore forming. The reservoir for Clostridium botulinum is one that will support growth. It needs to be anaerobic or without the presence of oxygen. Another requirement is that the environment needs to be low in acid. Examples of places that this bacteria would be found in are the soil, intestinal tract of animals, honey, and vegetables. And specific vegetables such as asparagus, green beans, corn, and beets that are canned have an increase of risk for botulism because of their low acid content. This disease is most common in the northern hemisphere, and there are a bunch of different types of botulism, but the ones that are most commonly associated with humans are types A, B, E, and F.
Signs and symptoms. A sign is an evidence of the disease or an observance of something going wrong in the body. A symptom, on the other hand, is evidence of the disease of a physical disturbance by the patient, something that indicates the presence of a physical disorder. So if we're not being able to move our arms, or if we're feeling chest pain, something like that, that is a symptom. There are different types of botulism. The first type is foodborne, the second type is wound-borne, and the third is infant botulism. Neurological symptoms. Neurological symptoms develop as toxins are released by the bacteria. The bacteria begins to spread throughout the body. The toxins affect the nerves in the skull at first, but without treatment, they will go to the arms, the legs, and then to the chest. And then because they're the chest muscles, it affects us breathing. So we begin to not be able to breathe because our muscles can't contract. The symptoms and signs are blurred or double vision. So if we're beginning to see doubles, or our vision is just beginning to be abnormally blurry, something like that. The second is difficulty swallowing. The third is dry mouth, which can lead to mouth sores. So if we're constantly wanting to drink water, but we can't get our mouths to stay wet, that is a symptom. The fourth is facial weakness on both sides of the face, difficulty speaking. So basically all of the muscles in our body stop working or begin to shut down because of this botulism. If we can't open or shut our eyes. The fifth is paralysis. So basically we go from running, jumping, walking to a wheelchair. Our muscles just begin to shut down through the whole body. It starts in our brain, our face, and it moves to our arms and our chest and our legs. The sixth is droopy eyelids. We kind of mentioned that a little bit above, but you're not able to open your eyes. It's a really hard time. Those muscles to open your eyes and shut your eyes are just not working. The seventh is trouble breathing. So we had talked about how our muscles just begin to shut down and stop working. So when we're breathing, we're having a hard time contracting our chest, being able to inhale and exhale that air. The eighth is nausea or vomiting and stomach pains. So basically, our stomach just starts hurting because of this bacteria that's in our body. Okay, now we're going to talk about infant botulism. Infant botulism can be caused by toxins, the same as the other two types. This affects the nervous system. It can be a little bit different, the signs and the symptoms can be, from those of the foodborne or the wound-borne. So the top three to look for are constipation, a weak cry, or they're becoming lethargic. So they're having a hard time using those muscles to either use the restroom or to cry, or they're just having a hard time moving, so they're becoming lethargic. Some of the other symptoms include weak cry, hard time sucking, has a hard time feeding, so they begin losing weight, getting smaller because they have a hard time sucking and breathing that in. Tiredness, irritability, increased drooling, floppy head, neck and limbs, or droopy eyelids. So if the baby is having a hard time holding his or her head up, that is a symptom. I know that it's kind of hard. I've read many stories of people talking about how they thought that their baby drooled a lot, but then one day all of a sudden they started drooling a lot more and they were just a lot more tired and they had a hard time crying and they wouldn't eat. That is what you need to look for, because each baby is so different. Some babies eat a lot, some babies don't eat as much. Some babies sleep more than others, some babies are more irritable than others. So just once you know your baby, and if these symptoms start arising, then it probably is infant botulism. Those are the signs and the symptoms of botulism.
Next, we will discuss how botulism is transmitted, how it may be prevented, and how it is treated when contracted. Transmission. Botulism is transmitted when toxins or endospores are ingested, inhaled, injected, or found within a wound. Botulism is not transmitted person to person. It may be transmitted through soiled diapers when a child has infant botulism. It is important to take precautionary measures when that is the case. The transmission of botulism may be prevented. Food-borne botulism can be prevented as food is correctly prepared and stored. If a wound becomes infected, especially a puncture wound, it is important to seek medical care immediately. If botulism is suspected, early treatment and observation is essential to recovery. Anytime an instrument is used to puncture the body, it is important to make sure it is clean. For example, the use of black tar heroin has been a recent cause of botulism outbreaks. The needles which are used to inject the drugs are typically dirty and prepared in unsterile locations. This gives a higher risk to the contraction of botulism and tetanus. Preventing infant botulism is more unique. Babies 12 months and younger should not be fed honey. It contains small amounts of endospores. Typically, humans have some immunity to small traces of the toxins, but infants do not develop the resistance until the age of 1. Should a baby become infected, it is important to be diligent in hand washing and disposal of diapers. Additionally, breastfeeding can slow the onset of symptoms. It is important that individuals who have contracted botulism seek medical care as soon as possible. That will give doctors the opportunity to diagnose the situation and administer the botulism antitoxin. Patients will be monitored closely and given ventilation support. The more extreme cases will need this respiratory support for up to 2 months. Infants with botulism receive the same monitoring and respiratory support. There is an orphan drug called Big Baby, which is a human-derived anti-botulism toxin antibodies that can help in the treatment of infant botulisms type A and B. Before the botulism antitoxin is administered, doctors will examine the patient's medical history to ensure the drug is safe to use. They will test for allergies and pregnancy and do a complete, full background, including what forms of medication the patient is taking. On March 22, 2013, the FDA approved a botulism antitoxin which neutralizes all 7 known botulinum nerve toxin types. This antitoxin is derived from horse plasma. The antitoxin is given through an IV or a shot. There may be adverse reactions to the serum, which include anaphylactic reactions, thermal reactions within the body, and serum sickness. Shelf life of the treatment is currently 4 years at -20 degrees Celsius. On average, there are 145 naturally occurring cases within 10 to 30 outbreaks of botulism reported annually in the United States. Of those individual cases, 25% are foodborne, 72% are infant, and 3% are wound-induced botulism. While the number of cases is relatively small, the mortality rate is high. The mortality rate, as recorded from 1910 to 1919, was 70%. After the development of the ventilator to assist respiratory function, the death rate dropped to 9%. By 1990, the mortality rate hit a low of 2%, mostly attributed to the development of a vaccine in 1965, which we will discuss next. The average mortality rate currently is 7.5. For over 45 years, there was a vaccine given to a select group of people for testing. The pentavalent A, B, C, D, and E botulinum toxoid aluminum phosphate absorbed, or PBT, was an investigational vaccine that was given to workers who had occupational exposure to botulinum toxins. The CDC, after 46 years of testing, observed immunogenicity of the toxin stereotypes in test subjects. They also saw immunogenicity of the booster of the vaccinations. These patterns, along with the age of the product, led to its discontinuation. The development for a new vaccine is still underway. From the discovery of botulism, there has been a fear of its potential use in biowarfare and terrorism. It is a high threat because it is easy to produce, transport, and has damaging, sometimes fatal results. In the following clip by the CDC, we will see a few examples of how botulism has been used in biowarfare.
During the Second World War, intelligence reports indicated that the Germans were developing botulinum toxin as a cross-English Channel weapon to be used against invasion forces. In light of this, it's ironic that a hand grenade filled with botulinum toxins may have been used by Czech patriots who were trained and equipped by the British to assassinate Reinhard Heydrich, head of the Nazi Gestapo, in 1942. Inconclusive reports suggested that he died from the effects of the toxin rather than injuries sustained from the shrapnel. The United States' interest in botulinum toxins may have grown in part out of our suspicions about the alleged German program. The Soviets studied botulinum as well. While the U.S. actually developed botulinum as one of the lethal agents in its arsenal, both the United States and the Soviets ultimately gave botulinum a lower level of priority. Botulinum's usefulness for dissemination over large areas was inferior to that of other agents like anthrax and tularemia. Botulinum appears to have been Saddam Hussein's favorite biological weapon. According to United Nations documents, Iraq produced 19,000 liters of liquid botulinum toxins and 8,500 liters of liquid anthrax. Much of this was loaded into bombs, and Saddam was apparently fully prepared to use these weapons.
We can see that the use of botulism has been effective as a possible bioweapon. The best way to protect against this threat is to be informed. We can prepare by understanding the signs and symptoms of botulism and what to do should it be contracted. It is important to look for the source of the outbreak as well. Avoiding the source, if it be infected foods or otherwise, will help deter the spread of this disease. This concludes our presentation on botulism. We hope that you are able to become more familiar with this disease and its implications. Thanks for watching.